Hello, everyone, and welcome to the first webinar in a four-part series by the UC Center for Climate Health and Equity, where we'll be presenting on evidence and innovations to confront the climate and health crisis. My name is Dr. Sherry Weiser. I'm a professor in the Division of HIV, Infectious Diseases, and Global Medicine at UCSF, and I'm very pleased to kick off the webinar today. I co-launched the center in July 2021 with Dr. Arianne Teherani, who is moderating today's session. Just to remind people, our mission is to harness that expertise and leadership of the health sector to drive ambitious climate action for health and health action for the climate. And our center is based at the University of California, San Francisco, but it spans all 10 UC campuses and 5 UC health systems with over 100 affiliated faculty. Our center has 4 strategic work streams, so research, education, health system sustainability and policy, as well as special initiatives like our new UC Climate Change and Mental Health Council. So as we launch this webinar series, I wanted to thank both the UCSF Offices of Sustainability, as well as the UCSF Academic Senate Committee on Sustainability for their invaluable support and contributions. So today we have a very exciting session focusing on climate and health communications. Our next 3 webinars will have different topics. So on Wednesday, April 12th, we will be looking at the health impacts of sea level rise. On Thursday, May 12th, our speakers will address how climate change is affecting mental health. And our last webinar of the spring series on June 14th will be about our food systems and their impacts and relationship to climate change. So it is my pleasure now to introduce today's moderator, my close colleague and center co-director, Dr. Arianne Teherani. Arianne is a professor of medicine and an education scientist in the Center for Faculty Educators at the University of California, San Francisco School of Medicine. She's also the director for program evaluation and education continuous quality improvement for the School of Medicine. Her research focuses on advancing knowledge and equity and social justice, and also on education for climate change and health. Importantly, her research positions education as a core solution to the climate change and health crisis. So she has examined the outcomes of successful endeavors to train health professionals and practicing clinicians to educate their students and patients about climate change, also on the role of health system science education in promoting decarbonization, and finally on the carbon footprint of ongoing, often unquestioned education practices. So welcome, Arianne. I will turn it over to you.
Thanks, Sherry, for the kind introduction, and welcome everyone. This is our first session in the series, and we thought it would be important for us to begin our dialogue with a discussion on solutions and a focus on communication science, which is the science of communicating to stakeholders, including the public, that really draws on a wide range of disciplines from the social sciences, humanities, the physical sciences. And so we are at really a stage in the world's history in which communication science has taken a critical center stage in the dialogue around societal problems, social movements, and we see that manifested most recently in the efforts to address mis and disinformation pervading our society. But really, communication has been a huge factor that has affected the dialogues around climate change for decades. The United Nations had put forward that communicating on climate change is about educating and mobilizing audiences to take action to confront the climate crisis. And so everybody really should be playing a role by raising their voice, sharing solutions, and advocating for change. And these are all shaped by different experiences, our positions, our professional, personal positions, our context, and our underlying values. So today, we're going to be focusing on communications and how health professionals, health sciences can effectively communicate science about climate change to general audiences, their patients, students, and policymakers, for example. So with that, I'm going to introduce both of our speakers up front. Trity Pourbahrami is a boundary spanner with 20 years of international experience in strategic communications, science communication, and employee engagement, spanning sort of higher education, government, and philanthropic and corporate sectors. Currently, she leads communications for the Gordon and Betty Moore Foundation Science Program. Before joining the foundation, she was the director of communications at the California Institute of Technology, where she collaborated on communications across all 6 Caltech divisions and NASA's Jet Propulsion Laboratory. In addition, she was the editor of the award-winning publication Ingenious. Trity earned her Bachelor of Science degrees in Physics and Physiology from the University of British Columbia and her master's degree in Social Welfare and Public Administration from the University of Hawaii. She is a trustee of the Institute for Public Relations. Dr. Ellen Peters is the Philip H. Knight Chair and Director of the Center for Science Communication Research at the University of Oregon, where she holds appointments in the School of Journalism and Communication and the Psychology Department. She has published more than 170 peer-reviewed papers and has authored the book Innumeracy in the Wild, Misunderstanding and Misusing Numbers. She is the former president of the Society of Judgment and Decision Making and a fellow of the American Association for the Advancement of Science, the Association for Psychological Science, and the American Psychological Association. She has worked with federal agencies to advance decision and communication sciences in health and health policy, including being chair of the FDA's Risk Communication Advisory Committee and member of the National Academy of Sciences Science of Science Communication Committee. Before I turn it over to Trity, who will be speaking first, I want to let you know that we do have the Q&A open, and we will have a bit of time at the end to focus on Q&A. Please submit your questions there, and I will share them with Trity and Ellen as we're going through the Q&A. And I'm going to turn it over to Trity now. Thank you.
Thank you, Arianne. You can hear me, I hope. Can I just get confirmation, Arianne, that you can hear me?
Yes, I was on mute. I can hear you.
Okay, perfect. Great. And I'm about to share my screen. Just want confirmation that you guys can see the shared screen. Yes?
Yes, we can.
Perfect. Hello, everybody. It is wonderful to be here. I'm in the middle of the consequences of climate change. You know, there was a major windstorm and rain in my neighborhood of Mountain View. So I have no power till potentially tonight, late at night. So I'm very happy to be here with you all from the Gordon and Betty Moore offices. I'm not here as a grant maker. I'm here as a science communicator. And what I'm going to talk about today has very broad implications, but the Moore Foundation's focus is narrower than the UC Center for Climate and Health and Equity. So my plan for the next 15 minutes is to start with who are trusted messengers, then go into 5 tips for becoming a more effective science communicator. And I've put my Twitter and LinkedIn information in the bottom because you'll see there are points at which, if you want more information, I'm happy to provide it through if you could just send me a message through LinkedIn. So let's start with this concept of a trusted messenger, right? We believe the people who we listen to and believe the people that we trust. I'm always encouraging my students to tell stories, so I'm going to start with telling a story. I recently went through a major health crisis, and who you see in the bottom of the slide is one of my chemo nurses who I got to know quite well and helped me through a very difficult journey. She was a trusted messenger for me. Nurses, doctors, technicians, administrators, anyone who's within the healthcare system is a trusted messenger. And you who are listening, I would believe, are many of the trusted messengers. So starting with that point of we are trusted messengers, how can we go about becoming more effective communicators? So take a moment. I hope you have a piece of paper and a pen. Think about a recent interaction you had with a patient. What was the core message you wanted to communicate to that patient or to that colleague? Looking back, how effective were you in connecting with their hearts as well as their minds? I hope that you keep this example in mind as I go through the 5 tips I'm about to share, and that at the end, I'll give you an opportunity to share in the chat about how it went. So the first tip for being a more effective communicator is defining your target audience. Who are you trying to reach? There are many that you could be reaching, but you need to narrow it down to who you're trying to reach and how can you gain insight into how that target audience thinks and what might be motivating them. Going back to my own personal story, I was going through the health crisis, but also my family was going through it with me, right? So looking at the patient and their loved ones, and each of us come from different experiences, backgrounds to that room, I am the target audience, right? So how do you get as much information as you can to optimize my uptake of the information being presented to me and help me be motivated to act on the information being presented to me or the patient or whoever it is that you're targeting as your audience. Tip number 2 is really thinking about the purpose. Why are you having this conversation, right? Why is it important for people to know this particular information that you're sharing with your target audience? Whenever we are sharing information, we should have a strategic purpose, right? We should have a goal, what we specifically want the audience to do, or how we want to change the behavior of the audience. And it's really important. The why is really critical to establishing the engagement and interaction that we want. Tip number 3 is, as much as scientists, as engineers, as medical professionals, as any professional, we have gained so much training and we've been ready to kind of stand up there as I am right now to preach or lecture what we know. The most effective way to communicate is to meet your audience. So take the hand of your audience and walk with them instead of talk down to them or pass information on to them. So what do I mean by that? Going back to my own personal story, right? I had a very long journey that involved many different stages. This is me in radiation, and I would go to that radiation room day after day for multiple sessions. And what was important was that the technicians, the nurses, the individuals met me where I was at. Didn't just pass a bunch of information to me, but walked with me and helped me understand what I needed to understand to make the decisions I needed to make, where I was in my journey. I really like this concept of we only change at the speed of trust. So once we gain that trust with the trusted messenger or individual, then we can begin to change. And again, what that requires is walking together hand in hand. Tip number 4 is, as much as we love the bleeding edge, we love the latest study, the latest information, to gain trust, we need to start with consensus science. We need to start with what's known and then move, again, hand in hand with our audience to where we want them to be. I have an extensive course that was about 30 hours that kind of teaches scientists and engineers how to go about doing this. And I use the hourglass approach, starting extremely broad with the background information and motivation, then going specifically into the particular solution you want to share, then again broadening to the significance and broader implications of your work. Why does this work? Because it reduces the fear of uncertainty and builds trust in science. The various elements that I just shared with you, the why, who, what, and how, come from an extensive curriculum that's been developed by the MIT Com Lab, and you can see their websites down there. I invite you to go and search more about it, or reach out to me on LinkedIn if you'd like to know, if you have specific questions about the curriculum. And finally, my final tip, and I would say one of the most important tips, is checking your assumptions. One of my favorite science communicators has this image, Tufte, in one of his books, where the ballerina is dancing a flower, of course, but all the audience members are seeing something different, right? we cannot assume the point of reference of our audience, right? And it is really important to acknowledge that they know that they have come to us with what they know to be true. So we have to put away our assumptions and walk with them and help them through that process. The best way that I know to put aside my own assumptions and be present is to listen. I'm a Persian and I love Persian tea. So I grab a cup of tea and I sit down and I acknowledge that we're all dealing with a lot of things. I put aside all my training. For many years, science communication was defined through the deficit model. I come in as the expert, I know some information, so-and-so does not know that information, I just need to transfer that information. There's a deficit in their knowledge and I need to address that deficit. That does not work with acute and prolonged crises. So our goal should be actively listening to our colleague, to our patient, and targeting their concerns and learning how to motivate them. So here are the 5 tips that I shared. So defining your target audience, being very intentional about your purpose, meeting your audience where they're at, beginning with what's known, and checking your assumptions. I'm going to stop sharing, and I would like you to use the chat feature of the webinar to put down one thing that you hope to remember from these 5 tips in my presentation. And then I'm going to pass it back to you, Arianne.
Thank you, Trity. And I think with that, I think folks will have to make sure they put it in Q&A because I think the chat's disabled. But
thank you for letting me know.
Yeah. We will go ahead and we will record that. And with that, I'm going to hand it over to Ellen. Thank you.
Trity, that was terrific. Let me see about sharing my screen. And maybe getting rid of the horse in my throat just momentarily. It is a pleasure to be here today. Arianne, thank you so much for inviting me. Trity, it's a pleasure to share the stage with you. As all of you know, climate change touches a lot of the things that are really important to us, including our health and well-being. And responding to it is going to require effective decisions to be made across society. But it's not, in the end, it's not society that will make those decisions. Instead, it's individual people who need to be engaged and they need to be motivated. And as Arianne was suggesting, one way to do this is through effective and evidence-based communication that places health and equity at the center of climate change solutions. What this can do is make the crisis personal, and it can make the benefits of climate action tangible. And it means that health professionals have a powerful voice. Trity gave us some terrific tips, absolutely terrific tips. By the way, your class sounds fabulous, Trity. I'm going to assume that's there. I'm going to start from there, and then I'm going to focus specifically on one key area. So I'm an expert in the science and in the psychology of decision making and how it relates to effective communication techniques. And today in particular, I'm going to talk with you about ways to harness the power of evidence, because evidence is important in medicine. Because sometimes people do need information, but they don't just need any information presented in any kind of way. By the end of our time together, what I'm hoping is that you're going to understand more about how being transparent with statistics can actually help people make better choices. And I'll also show you 2 categories of strategies that you can use to facilitate climate-related health decisions through strategic choices that you can make about how to present those numbers. Well, let's start with this. Did you know that the average person is thought to make about 35,000 decisions every day, including any health and climate-related decisions? What that means is it's really hard to cut through that onslaught. It's also necessary, given the many health effects of climate change that have already emerged and those that are going to be emerging in the future. Given the ethical duty that health professionals have to inform patients and to guide educated choices about health, the question is, what should be done? We know that public health messages can play a part, but health professionals also have a unique role to play. And that's because they are those trusted voices that Trity mentioned. Hearing a message from a trusted source like a physician or another healthcare provider, hearing a message from them tends to make the message more persuasive than it would be otherwise coming from somebody else. And as a result, people are more likely to follow the related recommendations. Because health professionals are trusted voices, they have a powerful megaphone. And because of that, they have a profound responsibility to effectively communicate health-related information and protect people in terms of their health, protect people in terms of the health effects of climate change. Today, what we're going to do is we're going to focus on health-related statistics because public health and medical practice are driven by data. But the question is, what happens when you provide statistics as opposed to not providing them? But in this world of ours, where a lot of people are innumerate, they're very poor with numbers. And therefore, some people, some policymakers and others will claim that we shouldn't provide statistics at all. What we're going to do today is we're going to talk about some evidence that knowing statistics, providing people with statistics, can actually help them make better choices nonetheless. Let's look at an example with prescription drugs. In the US, patients are generally provided with non-numeric risk estimates concerning possible side effects. So we'll get a laundry list, and we'll get this long laundry list that includes things like headache and constipation, skin rash, diarrhea, the list tends to go on. Sometimes we'll also be given a verbal descriptor, like the side effect is very common or it's quite rare. We're seldom told, though, what the numeric likelihoods of those side effects are. The problem with doing it this way is that when you don't provide the numbers and you tell two people, for example, that something is rare, they often interpret that word very differently. So to one of them, rare will mean 1 chance in 1,000 or a 0.1% chance. While to the other person, they're told the same thing, but suddenly it means it's something 100 times more, a 10% chance. Even within the same person, if they're in two different contexts, their interpretation of the meaning of the word rare can actually change with that context. So all of this can be problematic. What we could do instead then is we could give people a numeric risk estimates. So you could tell people that there was a 0.4% chance, or 400 out of 100,000 people who take this drug will get a headache, let's say. The problem with the numeric risk estimates, though, is that less numerate people, those people who just don't understand numbers as well, they're going to understand less, and they're going to tend to overestimate risks more than the highly numerate. A lot of people have thought that this means that we therefore shouldn't provide numbers, simply so we don't confuse the less numerate more. Well, we were very curious. We were curious about the question. We didn't quite believe what people were saying, but we weren't positive, so we did an experiment. We compared these formats in an experiment. So some people got the numeric estimates, some people got the non-numeric verbal descriptors, or just a laundry list. Similar to other prior studies, we found that people were 7 times more likely to overestimate the risks if we didn't provide the statistics. There was a vast misunderstanding of the likelihood of side effects happening from the prescription drug. Providing the statistics helped them. They also, by the way, were more willing to follow their doctor's recommendation if they were given the statistics. In addition, and unlike prior studies, we did measure people's numeric ability. And what we found was that the positive effects of providing numbers were strong. But they weren't just strong for the highly numerate, they were also, those positive effects were also strong for the less numerate. Providing numeric likelihoods of side effects helped everyone because there was a misunderstanding about how likely those side effects were. The more and the less numerate got a context for the side effects. They got quantitative indicators of how likely they were. And that context then seemed to drive understanding of the risk and also to motivate the healthier behavior of being willing to take the medication that the doctor prescribed. So in the end, numbers matter. Then similarly, and similar to prescription drugs, people also tend to be worried about the side effects from vaccines, but they actually they actually don't know very well how likely those side effects actually are to occur. So here too, when we provided numeric likelihoods, our results indicated that people understood more and they were more likely to intend to get vaccinated, even among people who are vaccine hesitant. We also did an environmental extension of this study when statistics were provided about the scientific consensus concerning climate change compared to when they weren't. Americans were more accurate and they were more confident in their estimates about that scientific consensus. And this was true across political ideologies. overall, when people get messages with numbers, they prefer them. They like to get numbers. They find them more useful and they find them more credible than the same messages without numbers. And providing numbers helps in some other ways as well. As we saw with the prescription drug and vaccine studies, it can actually help correct people who have the wrong facts. It can also help correct people who have inappropriate interpretations. It can help people avoid being surprised by an unexpected event that they just didn't know was even possible. And as a result, they can avoid the subsequent regret and even the anger that can follow that kind of surprise that happens. And then finally, emphasizing numbers may prevent strong emotions from causing people just to neglect statistics like probabilities, just to gloss over them. It may prevent that glossing over of numbers. But you can't provide just any number in any form. It turns out that how information is presented may matter as much as what information is presented, and that is particularly true for people who have less ability with numbers. To help people jump the information hurdles in their lives, and there are lots of information hurdles in people's lives, we can actually use what we know about the psychology of how people make decisions combined with the science of science communication. And what we can do with that is we can lower the hurdles that they face by communicating in an evidence-based manner. As Trity mentioned earlier, you first have to understand your audience. You have to know, do they tend to overestimate risks, for example? And you have to identify your communication goal and then use that goal to thoughtfully and mindfully choose what information to show and how to show it. Let's talk about some tips that I hope will help you become a better communicator. The first of these tips is to make numbers just easier to grasp quickly by reducing how much cognitive effort it takes people to understand what the most important information is. Numbers are simply hard for a lot of people, but they don't have to be as hard as they often are. When you reduce cognitive effort, you can actually increase understanding, and especially among people who are less numerate, who otherwise would be left behind. One thing you can do is just provide less. Providing less produces more comprehension. So you can provide fewer options or less information. In medical decisions, for example, if you think about providing fewer options, sometimes an option isn't really an option for that particular patient. So in some breast cancer cases, hormonal therapy might not really be a feasible option for that particular patient. If that's the case, she should never see that as an option. Reduce the number of options, and she's going to understand the remaining options better. Another case in health insurance choices, sometimes a choice option is dominated by the other options that are available. It's just simply worse than everything else on every possible dimension. In this case, if you're able, you're not always able to, but if you're able to, just remove it from the website. Again, fewer options means people can understand what remains better. Other times, the most important factor to someone, and again, let's think about health insurance plans. Some other times, the most important factor to someone is that the health insurance should cover visits to a specific doctor. Here, there should be a way on the website for a consumer to say that early on, so that plans don't cover plans that don't cover that doctor are simply never shown. And all of this idea of less is more is really important because making decisions is work. And if you can provide less information, fewer options, then people are going to understand more of what remains. But it does then take work for the communicator, of course. Another way to reduce effort is that you can do the math for people. For example, by keeping denominators constant. And let's look together at a health equity example and see what you think. You know, we know that a lot of Americans have died from COVID-19, but the disease has also affected populations disproportionately. At one point, 1 out of every 1,020 Black Americans had died from COVID-19, compared to 1 out of every 2,150 whites. So if you take a look at those numbers, from which group has a larger proportion of people died? Think about that. For some of you, this is an easy question. For others, it may actually be hard. For some people, it's impossible to answer this question, by the way. But this information should never have been provided in this way. I would maintain that it's the responsibility of communicators to do the math for you and show that data, in this case, using the same denominator. So what I did is I chose 10,000 as a denominator, and I simply did the math to transform the numbers. By doing so, it becomes much, much easier for most people to tell that a greater proportion of Black Americans than white Americans had perished because of COVID-19. Here's another example. It's a different kind of example, but in the end, we use the same kind of process. Here, the CDC reported, or really CNBC reported out, that about 4,100 fully vaccinated people had nonetheless gotten COVID and had been hospitalized or died. This headline caused a lot of confusion and anxiety at the time. People questioned whether the vaccines actually worked, and these reports likely reduced vaccination rates. So what could they have done instead of providing that single number like 4,100? Well, what we can do instead is first identify a communication goal, just like Trity said. So in this case, I would choose a communication goal to communicate the benefits of being vaccinated versus not being vaccinated so that people would have a comparison. And then we can transform the numbers so that they're out of 100,000 people in each population, and then provide the relevant comparison to those people who are not vaccinated. This now becomes a representation of the data that's much more meaningful, and it's easier to understand, and it meets my communication goal. Reducing cognitive effort is important. You can show less information and fewer options, and you can also and should do the math for people. And by doing those things, you'll have greater impact. But these aren't our only options when it comes to communicating numbers. We can also, sometimes information is just simply very unfamiliar, or we can avoid it. And so what we can do in these kinds of cases is we can provide affective and experiential cues. Let's talk about a couple of ways to do this, a few ways actually. One thing you can do is you can choose the format of the number carefully. So let's imagine in climate change, something in climate change has increased some important health risk to a 10% chance. And you think this is serious, but you know your patients are ignoring it. One of the things that you can do, and it's a subtle effect, but there is an effect of this. One of the things you can do is to use frequencies. You can tell patients, we expect this to happen to 10 out of every 100 people like you. And by using that kind of frequentistic format, what happens is you will often elicit more emotional images of whatever the outcome is, and people tend to perceive higher risk compared to if you just simply use the percentage. And so, for example, you might say instead, this will happen to 10% out of 100 people like you. It's a very subtle change in how you present the information, but it can have an impact on people in terms of emotions and risk perceptions. Also, if a number is unfamiliar to the patient and they can repeat back the number, I can say it's a 9%, but they simply don't know how to interpret its meaning. You can provide that meaning directly through something like evaluative labels like poor and excellent, or above average or below average. And this addition on top of the numbers can help people understand not just what the information is, but what it means for the decision they have at hand. And as a result, they'll be able to use the information more in judgments that they make, in choices that they make. You can also take advantage of the power of negative framing. So for example, instead of saying the static statistic, 37% of heat-related deaths are due to climate change. This is what was done in the original research. Instead, you could emphasize the growing mortality. Heat-related deaths have increased by 59% because of climate change. And not only that, but you can provide a call to action, reduce your risk, develop your heat action plan, and provide concrete information that feels doable to the person so that they know what to do as a result. Now, these data are global data. They're based on a paper that came out in, I think, 2021. But hyper-local data tailored to where the person lives, so it feels like more of an impact on their lives. That kind of hyper-local data, it's more relevant to them, and it would likely work even better here. To maximize how effective they are, health professionals should lead with evidence. They should start by identifying who their target audience is and what the communication should accomplish. They cannot simply provide all of the information and rely on patients to pick out what's important and make wise choices. After identifying their communication goal, they then need to strategically choose how to present that information. Providing statistics as part of these communications can inform, correct misperceptions, and provide a more complete perspective. But those statistics can't be provided in any old way. They need to be provided in an evidence-based manner. So what are the key takeaways? The first one is, it's hard to communicate effectively. But the science of science communication exists, and it should be used strategically in order to convey climate-related health risks and motivate behavior change. You can have a bigger impact by using evidence-based communications. And this is critical today when people are the ultimate actors when it comes to health and well-being for themselves and also for society. Thank you very much.
Thank you, Ellen. And maybe we can open it up for discussion. I do see some questions already in the Q&A. So I think this is very helpful framing. And the first question we have is a very, very important one. And it connects to something that you both mentioned about the role of the health professional, which is, how do you both think that the pandemic has changed the assertion that physicians and public health officials are trusted sources? How does that influence the role of the health providers providing climate change and health communication? And whichever one of you feels more comfortable starting.
So I'm happy to start with. I'm happy to start. I'm sure Trity will have something to add here. There's Pew research that's out that does show, in fact, something supportive of what the person said, where medical scientists and scientists in general, in fact, have become less trusted across the course of the pandemic. And that story made a lot of big headlines around the country and perhaps around the globe. What's interesting is if you dig a little deeper into those data, and what you see if you do that is that everybody is less trusted. It's not specific to health professionals. Police officers are less trusted. Our Congress is less trusted. High school principals are less trusted. There's a whole array of people who are actually less trusted, so that in the end, when it comes to trusted sources, medical professionals still come out on top. And so there has been a decrease. It may well mean that health professionals are somewhat less effective, but they are nonetheless going to be more effective than pretty much anybody else, except perhaps family and friends. I don't know, Trity, if there's something you might like to add.
Sure. First of all, thank you, Ellen, for a great presentation. What I would add is, as Ellen alluded to, there are various studies of trust, right? So one of them is the Edelman Trust Barometer. And yes, overall trust has dropped, but there's certain categories like scientists, like healthcare professionals, where the trust is still high. And what the category of my leader, my CEO, a lot of us trust the leader of the organizations we're a part of. And we go to them for information. Like during the pandemic at the Moore Foundation, Harvey Feinberg would stand up every Tuesday and answer any of our questions regarding COVID. And that significantly built the trust among the staff of the foundation and between us and the leadership of the foundation. So there are many ways to build trust. I would agree with Ellen that the drop is not as significant when it comes to the healthcare professionals and scientists and engineers as a whole. We just have to figure out how to be effective, right? We need to figure out what are the motivators of the people who are potentially saying that they have less trust in us or our understanding of the system, or various things. Is that helpful, Arianne?
It is, and I think maybe sort of building on the heels of that really important framing is that how do you think this general way in which trust is approached influences the role of health providers when they are trying to provide communication either to patients or the public about climate change and health, and how to protect one's health in the case of a climate event?
Can you repeat that again? I didn't quite capture the essence of the question.
I think the question is, how does sort of what you are both alluding to and what you described, how does that affect the way in which health providers can provide climate communication to patients and the public?
I mean, I would start as a health professional, I would start with the things that Trity talked about. Start with knowing that you are more than likely a trusted messenger, so that you have a microphone. I would think about understanding, particularly if you have a relationship with a patient, thinking about what do they know and not know, and how are they being affected by climate change. And depending upon what you know about them, collect more information if you can, but trying to target the tangible things that are happening to them. And then potentially, depending upon whether they want to hear about it, and I would probably check in with them. I would probably ask them, are you interested in hearing how this, here's what's happening. We think that it's affected by, what's happening is affected by climate change. Would you like to hear more about that? Some people are not going to want to. Some patients, just because of political views or whatever, just simply aren't going to want to. And at that point, focusing just in on their health and what they can do for their health is probably the best way to go. Because they may not be changeable, and they're in your office. And so and if they don't want to hear it, they don't want to hear it. And that's that's sort of going back to Trity's idea of meeting them where they are, because you can talk with patients about the health effects without talking about climate change. Or for some patients, it's actually really helpful to talk about climate change, because then what you can do is you can start to think about, okay, these extreme heat cases that are happening in our city. Well, we know that climate change is happening, and because of that, we know that these heat cases are going to be happening more often. And so maybe you want to think about finding out more about, well, where are the cooling centers that are near you, and making sure that you're up to date on exactly the kind of tactics that you should take in order to protect yourself from that heat. But that kind of patient would be different than, if they don't want to hear about climate change, you can still talk about those kind of cooling centers, but then it becomes a little bit harder to talk to them about the trajectory without talking about climate change. You can do that. I'm not sure if it would be quite as effective as fitting it in with that model of climate change that's occurring, so that they can really understand this is going to happen more and more often. So that's how I would begin to think about it.
Yeah. I was going to say that's very helpful, actually. I think the tangible example of how to approach the encounter with the patient and really meeting them where they are, I do think is something that we don't often think about. And some of the early work that we did at UCSF with an institution in the Netherlands did in fact point to that depending on context and where the patient was that was sitting sort of across the table, and their understanding of the climate and health crisis and what their fundamental belief systems were. If the message was received differently, and I think that that's a very appreciated point of view. Trity, I want to make sure you didn't want to add something to this. There are a whole lot of questions coming in, but I want to make sure that.
I'm just going to double click on what Ellen said. I think she said it very well.
Great, wonderful. All right, so what does the role that communication science plays what is the role that communication science plays when opinions are shaped more by identity affiliations than persuasive arguments and evidence?
I mean, this is why I started with trusted messengers, right? Every community has trusted messengers. I just read Adam Grant's book, Think Again, and he talks about a case in Quebec of a mother who was very much against vaccinating her children, and then she had a premature baby in the hospital in the middle of COVID. And what that incredible community at the hospital did is find somebody who did a motivational interview with her on why nobody wants their child to die, right? But the question was, how can you get to a point, how can you hold her hand through the process such that she agrees that vaccination is the right thing for her child before the premature child leaves the hospital, right? And so that is the critical element, right? Finding trusted messengers. So the person who talked to her was a motivational interviewer and was a trusted messenger who then made her a trusted messenger in her community. And she led the effort for a lot in her community in Quebec, Canada, to get their children vaccinated, right? So again, we need to find those who are listened to, who are trusted, and that the change happens at the speed of trust, right? So once we have these trusted individuals, then we begin to see change happen towards more evidence-based decision-making. Ellen, did you want to add anything?
Sure. First, I love that saying, change happens at the speed of trust. That's very nice. What I just wanted to add another, so I agree with Trity. Just another little bit of evidence. A lot of people have been vaccine hesitant during this pandemic. There's been a variety of different studies, but one study in particular used a YouTube ad, but they had multiple YouTube ads. In that YouTube ad, in one of the versions of the YouTube ad, the vaccine, they had Trump saying that he approved of the vaccine. And then in the other ads, there was something else happening. And what they did is they showed different rural counties, either the Trump ad or other ads, and they looked to see what happened to the vaccination rates. And what they found was that vaccine rates went up in those counties where the Trump approval ad went out compared to other counties. So this trust is just, you have to start with trust. The message goes nowhere otherwise. People reject the information, they reject the messenger. And you can even you can actually get backlash kinds of effects if the messenger is not trusted. So you want to make sure you start with that trusted messenger.
Yeah. I think that's actually a great segue. There are a group of questions about trust and data, and I'm going to try to get through them in an order that I hope is logical. There's one very critical one, given that our center really focuses so much on working with communities. There's an important question about if we are presenting to frontline communities that we may be outside of, so either socioeconomically, racially, et cetera. What are the best ways to reach our audiences in those situations? Is there a way to address it head on at the start to obtain trust? As you think about the pros that you both have provided for trust, and working with frontline communities, how would you think about what that opening should look like with the communities?
So I would go, oh, sorry, Ellen, did you want to come in first? I would go with how I train scientists and engineers, right? You start by getting as much information about the community you're going to as possible. You understand that community, you find allies who will work with you and who will explain to you what are the motivators of that community, what are the hesitations of that community. And if possible, you go in with that ally, right? So you are co-presenting this information with someone who's trusted, because you are not the trusted messenger in this situation. You need to find the trusted messenger and walk in with as much information as you can about that community.
I completely agree, and not surprisingly. The one thing I would add on top of that idea of co-presenting and walking in with opinion leaders who are in that particular community, I would add on top of that, test your messages. You may not have time or money to test them in a very formal way, but you can informally test your messages, starting with those allies, moving on to the opinion leaders if they happen to be different from the allies. But then even with some early conversations with people in the community, trying to figure out, well, does this message resonate? Is it hitting on the points that are actually important and valued by this community? Or am I just off base and I kind of need to go back to ground one again and think through what I'm talking about again, based on what I know about that community, what they know, what they don't know, what they want to know. And also, but not the only thing, what experts think that they should know. That you need to bring all of that on board along with those allies and opinion leaders.
That's fantastic. Thank you very much. Okay, this is a very interesting question. A few years ago, the emergency room at a local hospital in Fresno was inundated with kids with asthma attacks because of horrible wildfire smoke. In that kind of situation, it's an emergency room, it's chaotic, lots happening, a lot of input, output. What would be an effective message that the health professionals in that situation could share?
I have to ask a few questions back. Who are they sharing it with? Why are they sharing it? What is the purpose of sharing this information?
let's say that would be similar to any other patient encounter, really thinking about making sure that what you want your patients to walk away with is a sense of being able to protect themselves. So yes, of course, you take care of the health problem first to make sure that your patient is safe, but you do want to make sure they have some messaging in that situation that when they are discharged or when they're walking away from the clinical setting, they have a way of protecting themselves.
I think this is a little bit of a tough one, and I suspect it is for Trity as well, because we don't know what the health solutions are. So I'm assuming let's assume that the health problem, the acute health problem is taken care of immediately, because I just don't know what that would be. Again, psychologist here. So the acute health problem is taken care of, and then what you want them to walk away with is a sense. What I would want a patient to walk away with, and it might depend on what their political ideology is, but what I would want them, depending upon their ideology, to walk away with is the notion that wildfires are here and now. They're happening. They're going to happen again, and that means that you need to be prepared. But there are things you can do to be prepared. There are things that you are, and to give them in psychology, we talk about it as efficacy, self-efficacy, and response efficacy. So you want them to walk away with the idea that here are these things that you can do, because this is going to happen again. Here are these things that you can do that will work, and you can do it. You can have the confidence to take charge of this situation for yourself or your child. I've forgotten who you said the patient was, but that can help prevent this. So you don't even maybe hopefully have to come back to the emergency room the next time. But that's the way that I would think about it there.
That's great. Thank you. That's very helpful. Yes. Okay, so now there are a group of questions that focus on trust in the media. So the provision of data and studies that may not be representing the truth of the situation, maybe potentially exaggerating. And then how as a healthcare provider can one address that? You have a patient come in and say, I heard from the media that XYZ is happening, and oh my God, my health is in trouble. What am I going to do? There's been a climate event, and I don't know. If we think about yesterday, for example, how many people were hurt as a result of the heavy winds. Is there a role for the healthcare professional in communicating some of sort of the mismessages communicated by media? That's the best way I can summarize this particular series of questions.
Okay, so first of all, you have already won. The person has come to you with their misinformation, right? So you are now officially a trusted messenger. So take a breath, okay? Start with questions, right? Like, acknowledge, thank you for bringing this to me. I really appreciate that you've trusted me with this information. How can I be helpful? Open the conversation up. Use your active, constructive listening skills to see what you can do to help them. And that starts building a relationship with this individual so they're more likely to come back to you, right? So that's in the moment, I would say. I am a big advocate of scientists, engineers, medical professionals being active in bigger arenas such as social media, because I think if you are an expert and if you have a community that is listening to you, you could begin to counter some of the thinking, but that requires building trust and building a community, right? So those would be my 2 points. You are trusted. They've come to you. Let's start there. Ellen, did you want to add?
Yeah, first, I thought your point about the fact that they came to you means that you're trusted. I thought that was great, Trity. A couple of the things that I would just add is here's what is true. Tell them what actually is true. Don't repeat the misinformation. When we repeat information that's misinformation, we build up memories for it, and people may lose track of what's true and what's not true. So repeat the true information, not the false information. And then the other thing that you can do is you can say, you know, I don't know where you got that information, but there are a lot of sources out there that are not trustworthy, frankly. Here are some trusted places on the internet. Let's assume they got the information on the internet. Here are some trusted places on the internet where you can go for information, and point them to the sources that you yourself trust and would want patients going to.
Mhm.
Again, it's about kind of arming them for the future.
And if I may add, unwrap your process as well. So what Ellen did just now, right? You can use yourself and say, when I look at information, I think about, where is this information coming from? How many times has it been forwarded? Is it a source that I trust? So unwrap your process, and then you're walking with them, right? You're not the person saying, don't listen to this information, this is misinformation, but you are a human as much as they are. And together we can figure out how to walk through this information.
That's very helpful. Thank you, both of you. There's a question about the presentations making an assumption that science communication revolves around a rational cognitive approach and the framework whereby facts, when clearly presented, will influence decision-making. What is the role of emotion-based and affective strategies in communicating climate change and health science, especially when there's an imperative to persuade, as opposed to promoting shared decision-making in clinical decisions?
So I have to admit, I'm a very big proponent of shared decision-making over time, because it is part of how we build trust. Starting with what we know about science and communicating it as best we can is part of how we build trust. One of my specialties as a psychologist is actually the role of affect and emotion. I've studied it quite a bit. And it does have a role. You have to be careful with it in communication. So you can communicate emotionally through images, through stories. There's a variety. You can just through words. And in fact, there's even some ways with numbers that you can sort of communicate emotionally. It's milder. The potential issue with there's a couple of potential issues with communicating emotionally. One that you can think about, let's imagine you tell a story, and it's a very emotional story and it's very persuasive. And your patient, while they're in the office, is very persuaded, and they're going to take that action. And then they walk out the door and they run into a friend, and that friend tells a different emotional story, and they have a different emotional goal in mind. And it completely counteracts the effects of the emotional story that you just told them. And it was a great story, but somebody else told another one, and it was a trusted person. So you might be trusted, but so was the other person. And so then you may end up with a patient who's confused. But if you told that emotional story and you blended in the story of the evidence, whether it's numeric information or some other kind of information, what you do is you can build up the story of science in a sense. And so that you can get people to think more deeply and reflect more deeply, not just react to the emotion in your story, but to think about it and think about what it means in the context of their lives. And that elaboration process actually can mean that you have bigger impact, not just in the short term from the emotion, but in the longer term because of that elaboration. So that's sort of how I would think about that. The other thing you do have to think about with emotional communications, and here I'm thinking like graphic images. If you think about like cigarette packs, again, and this is sort of there's sort of a political tilt here. People can get really reactive, and so they get angry. They think you're exaggerating if you use these kind of emotional communications sometimes. And so you just have to watch. You have to watch for that, because you don't want to give a message where your patient, in this case, just gets angry at you about it. And so it's sort of a fine line. It's sort of a fine line there. Is there anything you'd like to add, Trity?
You said it perfectly. One of the classes that I still teach is persuasive communication, and I happen to be teaching that class to physicists and policymakers, and it's fabulous to watch them react differently to the emotional appeal. There's the emotional appeal, there's the logical appeal, there's numerical appeal. There are different appeals, right? And a physicist reacts very strongly to using an emotional appeal to do any kind of science communication, right? Whereas a policymaker is like, no, I know emotion gets you far. Right. And it's quite a dance. It's quite a balance. Right. I tried to demonstrate today. I shared my health crisis, which is a very emotional thing, in the middle of kind of like an academic conversation about 5 tips for effective science communication, right? So you could dance between the emotional side and the logical side if you know your audience well.
Wow, thank you so much. This has been fantastic. I think the wonderful tangible steps, the emphasis on the role of trust, the emphasis on who comes to talk to you first and the role in which they envision you as a healthcare provider has been incredibly helpful. We are right at 1 o'clock. There are many, many questions I didn't get to. I apologize to the audience. But thank you both very much. And we look forward to learning more about your work into the future.
It was a real pleasure, Arianne. It was great to be here. Thank you everyone for your questions, and Trity, it was a pleasure to see you as always.
Same here. It was a pleasure, Ellen and Arianne. Thank you so much.